I personally believe you should not think much of recognition. If you are into emergency medicine, do an MEM or an MRCEM, go to UK, do an FRCEM, get yourself recognized. Everybody is not that good. So it is an alternate pathway by which people can go to UK, do an FRCEM, which is recognized by an MC.
Can you guide us for regarding the emergency medicine courses? Because in the market, what we have
Okay,
is
so
MEM or MRCM is less. So it is worth it or not?
so I'll discuss about it in a bit right now. So see, um, I came from a background of emergency medicine in 2003. I came from a background of internal medicine. So I had a degree, postgraduate degree in internal medicine. Then I went to UK, did my MRCPs and did a lot of things. And then I used to practice. I passed in the 90s and I used to have a good practice of internal medicine. In 2003, I, along with my friends, went to Kerala to start a thing called IIAMS. So it was an emergency medical service, and it was more based on ambulance. So many people considered me as a pioneer of emergency medicine in India, but that's nothing. So what I did after that, I got into emergency medicine uh, uh, to study what was being taught into emergency medicine, and I became a student to learn emergency medicine. I went to UK, and then I went again to US. I went to Alfred in the Melbourne, Australia. I went many places to have an idea what was emergency medicine. So as I got an idea of emergency medicine, I, along with my friends, started doing a lot of work to uh, to ask the government of India to recognize emergency medicine as a specialty. In other countries, it was recognized in 1976 and before. In our country, we were able to recognize it by the government of India in 2009. I was one of the members who was there during the recognition time. Then I was after the government body, and I was going on, and I was the first guy who got emergency DNB emergency medicine in 2014. So I started emergency medicine DNB 2014 with 3 students and with primary and secondary seats. Now, before that, I also was involved in training people in order to make a good supply of manpower. I also trained a lot of people who were doing their masters in emergency medicine. So that was called MEM. It was initially called Fellowship of Emergency Medicine for 3 years. It was initially 2 years, became 3 years, and it name changed into Masters of Emergency Medicine, what you call MEM. So what is good about MEM is the course which George Washington University held, because they are pioneers in emergency medicine all over the world. GW, George Washington University. They helped us or the Indians to set up a course or a course structure on which emergency medicine training will progress. So they helped us in setting up these 3-year fellowships. Based on this, our DNB started. Based on this GW MEM course, it started. But the problem with the GW MEM course is it's not recognized. It's not recognized by government of it. That is the problem with the course. But as a course, if you want my opinion, it's a good course, because it teaches, if you do it from a good place, it teaches you a lot of things, right? And you become trained as an emergency physician. So the next thing is MRCEM or MRCEM. So that is an additional qualification recognized or given by the government of India, but it's an UK postgraduate degree. So you cannot take any country's postgraduate degree very lightly. They are giving it as their postgraduate degree, right? So what is the minimum criteria? You can appear the steps A and B without experience, but in emergency medicine. But if you sit for the practicals of MRCEM, you have to have an 18 or 1.5 years of training in emergency medicine. So they have kept it there. So if you are going for OSCE, you have to have 1.5 years of training. I personally find if someone has to do MRCEM, he can do an MRCEM, he can do an MEM, which gives him a 3 years residency program. And in that, while doing that, he can also do clear his MRCEM. So that will give him 3 years of training in emergency medicine along with a degree of MRCEM, by which he can go to UK or Commonwealth countries or Australia. He can have a GMC registration and work there. This is an alternative pathway. If you are very good, you can always go for DNBs or MDs in emergency medicine. But everybody is not that good. So it is an alternate pathway by which people can go to UK, do an FRChem, which is recognized by NMC. FRChem, the same part A and part B exams will be given in UK after training, after 1.5 years, and you can get an FRChem degree, which is recognized by NMC. So you have a pathway by which you can get yourself recognized. So don't think much about recognition. I personally believe you should not think much of recognition. If you are into emergency medicine, do an MEM or an MRCEM, go to UK, do an FRChem, get yourself recognized. You're good enough. You are already into the alternative pathway. You haven't cleared your NEET PG. So why are you thinking so much? I have not cleared my NEET PG. I need to find an alternate way to go to the top. So if I want to go to the top, I have to do an MRCEM, I have to do an FRChem. Simple as that.
Yes. Okay, sir. Then
It's nothing like MD versus. For me, see, my DNB students all are doing FRChem. They have to do. So these are my students are given the opinion that DNB, you have a recognized degree, you can work in India, but with the DNB you cannot work in UK. So do your MRChem and FRChem. So they are forced to do double degrees, and in this 3 years time only. So I have made it compulsory for my students to do it.